In this day and age, it's really fun time for assessing rhythms on our own. People wear wearables, and those are the watches like Apple Watch, Samsung Watch, Fitbit Watch. I get that a lot. And there's these alerts, and they say, is this real or is this fake or is this something I should panic about or not? And this is a common question. The issue with wearables, I will say, is that we do have a lot of false alarms. I have to say that. Give or take, in my experience, 60% of the time it's right. The watch gives you the EKG data and it dumps it on your phone when you've properly coordinated the two devices. And then on your phone, you can see the rhythms. The algorithm tells you whether it's atrial fibrillation or some kind of rhythm problem. And then sometimes it's not correct. So what I have patients do is bring that phone in, and then I review it with them and decide what's real and what's concern and what's not. Common problem with these rhythms when people bring them in is it happened before, they don't know if they were feeling symptoms during the time and all of that, and they're not medical grades, so they're not FDA approved for initial diagnosis. However, they're so convenient that I love the data anyway. It's portable, people bring it in and I can review it. I recommend them because they're so convenient as far as use. Otherwise, we have to put on the monitors that we use. They're sticker adhesive. They stay on for a week or 2 weeks or 30 days, and those are really hard to tolerate. Even though they're not medical grade, I still often recommend them because the data comes in on the phone and I can review it, and it can trigger more workup. For example, it'll say atrial fibrillation, and I can ask the patient, oh, I remember that. I felt palpitations or fluttering, and it made sense because the watch caught that. Other times they'll say, no, I didn't feel anything, at which point then it does trigger using a monitor device like we use in the office to track it, to see and verify how accurate the wearable watch is as far as diagnosis and picking up rhythm problem. That's why with these wearables, these watches, I love them, but just keep in mind, don't panic, just don't ignore it. Bring it in, we review it, we can decide what is next and if it's worth chasing after further with more testing.